Each of you has something very essential in common with every other person in this room, with each member of our community, and with few exceptions, with every living person on the planet. Some more than others, unfortunately, and I bet some of you are in the midst of it right now. But all of us await this inevitable time of our human existence, a time when we're vulnerable and dependent, but also courageous and hopeful, the times in our lives when we're a patient. It begins with a beautiful, but commonly medically assisted entrance into this world when we're born, followed by most with routine childhood vaccinations, school sports physicals, and those unplanned trips to the emergency room to heal the broken bones and to treat the minor injuries of our young, active lives. Next, those pesky annual physicals that we try to put off, but for some reason, we're ultimately compelled to do them anyway. Then we enter our own childbearing years, and as mothers and fathers, we become immensely involved in the medical planning of the perfect childbirthing experience, but often discover for the first time the true wonder of modern medicine and the miracle of bringing life into the world. Middle age hits next, and with it, so do the frequent screening, procedures, and exams that can identify diseases early enough that clinicians can often successfully intervene. And then we get older. We get sicker. We struggle with age-related illnesses and comorbidities, and we become frequent utilizers of the healthcare system as we all valiantly fight another trait we all share, our mortality. Patience. We are all patients. And the etymology of that word helps us think about what it means, especially as a group. A patient, a person who is being treated for an injury or an illness, traces to the Latin word that means one who suffers. And it shares its origin with the adjective to be patient, enduring without complaint, to wait. I'm sure the irony is not lost to those of you who have been in a medical waiting room recently, that our ancestral linguists knew to be a medical patient and to wait patiently would be so inevitably linked. So as patients, we seek relief from our suffering and we want to live a healthy life. So how are we doing? There was light. The answer we know is not good. Though the United States spends more on health care, both per capita and a higher percentage of gross domestic product, American health is by most metrics worse than that of other nations. Our infant mortality rate is higher, our life expectancy is lower, we have higher rates of chronic condition, and we are the most overweight nation on the planet. Why? What can we do? Before we explore that, let's first consider our important partners in the pursuit of better health. The physicians, nurses, and other healthcare professionals who either independently or as part of the care team serve the Hippocratic Oath, to show beneficence to all and to do no harm. So let's focus on the physician today. It's a representative of the care team. The word physician comes from the Latin word physicum and the later French word physic. And both of those mean a treatment or a remedy. And from that, we got the word physician, a medical practitioner, or one who holds the remedy. Most physicians went into medicine for altruistic reasons, to serve and to heal, and to experience the physician-patient relationship that among human interactions remains unique and profound. But being a physician isn't what it once was. Our physicians are burnout. 50% of them, according to most statistics. They're emotionally exhausted, they're working longer hours, they feel depersonalized, and most importantly, they don't think they're doing as good of a job as they need to be. According to the American Medical Association, half of a physician workday is spent on electronic health data record entry and other administrative tasks. I assure you, they'd rather spend the time that they do now looking at the glare of a computer screen, peering into the lights of your eyes and listening to the beat of your heart. So, as patients were collectively struggling, And as physicians, we're collectively struggling. So this is the backdrop to modern American medicine. But there is also good news. Crazy advances in technology, breakthrough medications, 3D printed body parts, and big data and powerful information that's coming out of all of that electronic data health record entry. Personalized medicine, cures for cancer, the microbiome revolution, and so much more. And on the opposite end of the technology spectrum, there's another important movement underway. Evidence is growing rapidly that there's something very powerful but simple that can supplement the traditional elements of medicine and change the healthcare reality of the future. And here's what's great. It's free, it's universally available, it's infinite, and it works. It's our experience. Our human experience, how we feel when we're in a healthcare setting, what we see and what we hear, the words that are spoken to us, and our emotional and intellectual response to them. The patient experience is what's beneath the surface, the deeper, more visceral exchange. But we've known this all along, haven't we? That what happens to our thoughts and feelings matters equally to what happens to ourselves. And although the idea isn't new, the time has come for us to consider it with urgency and to realize that we're at an inflection point, a time of rapid change and great opportunity. Positive thinking, laughter, words, thought, prayer, love. Researchers continue to understand the potency of these human feelings, human actions. And here's what we know. These experiences can reduce the rate of death from cardiovascular disease, lower rates of depression, reduce stress-related illness, strengthen our immune system, increase our resistance to the common cold, improve our well-being, and yes, increase the lifespan. Let's think of it as the experience placebo effect, the placebo effect. And that's a new word because I made it up. The word placebo is also Latin in origin, and it means I shall please. A placebo is an inactive ingredient that's often used as a control in a clinical trial, something I'm very familiar with in my line of work as the director of a clinical research program. The placebo effect is a psychological phenomenon in which the recipient of a placebo perceives an improvement in their condition based on their expectations. And that's the key. A person's expectations, a component of the experience, makes a difference separately from the treatment itself. So, patient experience. It results from and is an extension of this word, culture. A health system's culture, its belief system. But here's the tricky thing about culture is that it cannot be espoused. It has to happen organically. It has to become part of a health system's DNA. And when it does, the full of an organization, all of its people have a clear sense of purpose and they know their why. And when they know their why, they have an unfettered focus and a deep custody of belief, not only in the importance of the work, but in the importance of their individual contribution to it. So let's see how we're creating this right here at home. I'm one of 16 cultural ambassadors at a local health system, and we're charged to lead our organization's culture. And over the last few years, we've implemented a lot of different activities, initiatives, programs, and policy, and they've culminated in a series of words of the moment. Words such as mindfulness, sensitivity, and ownership. And we ask ourselves, can words and the principles and behaviors they conjure make good medicine and create a community of health? So let's first focus on the word of the moment, openness. And I start with openness because without it, individual beliefs and system cultures are impermeable. Are we open? Because if we're not open, we're only one other thing, we're closed. Do we think that how we treat people can impact their health? Well, US health systems do. 8 out of 10 of them have patient experience not only in their 3 to 5 year strategic plan, but they have it at the top of it. And it's not surprising because in addition to being the right thing to do, government and other payers are beginning to incentivize or are incentivizing health systems based on hospital and clinician group patient consumer experience surveys. You may have heard of them, HCAHPS and CGCAHPS. But what about at the individual level? Do the people in the daily grind that are taking blood pressures, collecting lab samples, and holding scalpels, do they believe? I was talking to a physician recently, and he said he thought our experience-based efforts were a little trivial. And he questions them because he thinks they're common sense, and it shouldn't be necessary for them to be orchestrated, for them to be prescribed. And he's right, they shouldn't, but they do. People vary widely in their background, in their personal experiences, and how well equipped they are to deal with others in stressful settings. And trust me, especially in the front lines, healthcare is tough. People also vary significantly in their training and education and how much they know about self-awareness and about interpersonal communications. So we're making no assumptions. We're ensuring that every healthcare worker is empowered and skilled to reach their full potential in the human health exchange. The next word of the moment is connecting. To be connected means to be united physically, or by principle, by purpose. And as a Kansan, I think about our beloved prairie tall grass, the 2-foot-tall sea of grass, warm with the sun and alive by the wind. Do you know what's beneath the surface? What's underground is a very atypical 15 feet of root that extends far beneath the soil. Above ground, the grasses, the plants, are really just the photosynthesizers collecting sunlight to nourish the much larger community underground. And beneath the surface, the roots are connected. They're connected so that they can protect the soil from erosion, so that they can feed the soil. And they're connected so that they can do together what they can't do alone. And a healthcare system, an organization, has to be connected beneath the surface to support, to sustain the workers above ground, to feed the mission, to care for others, and to care for each other. The next word of the moment is inclusion. Inclusion is important in healthcare, in business, in society, and in life. It's become a little bit of a catchphrase to represent the philosophy and related programming that ensures all people are treated justly and have equal access to resources and to opportunities. There's something I think we've forgotten about inclusion. We have our educators to thank for bringing inclusion to the forefront in the 1970s when they went through remarkable efforts to incorporate special learners with standard learners in the classroom. But let's go back even further. Let's consider the original meaning of the word inclusion. Its Latin original meaning is to shut in. To shut in, I know it's a little jarring at first, and I had to think about it a while and hover over it for a few days before I understood it. And I figured it out when I compared it to, contrasted it with, to shut out. Of course, inclusion means to shut in, to bring others within, to bring them inside. And when we do, when we shut others in, we're better, we're stronger, we're wiser, and what we become is truly remarkable. We become human beings taking care of human beings. So think about 5,000 healthcare workers in a system that delivers about 800,000 face-to-face medical services in a year. And if each of those is supplemented by just one event to schedule or to register, and then on average 2 more interactions in a year. And if one of those is shared with a family member or a friend, we're totaling 5 million human interactions. And if those interactions are open, if they're connected, if they're inclusive, if they're kind, think not only about the impact on our community's health, but also on its people. So we have one last guiding word, and this one is for all of you. It's for all of you as patients, it's for all of us as a community. And it might seem a bit of a stretch at first, but it does not minimize the pain, suffering, and tragedy that patients and families experience every day. Your word of the moment is play. To play means to participate in, to occupy oneself with, to take charge of. It means to show up to the game. Playing stimulates us, it teaches and improves us, and it reminds us why we care about our health in the first place. So let's become fierce competitors, active members of our healthcare team. Let's share in the decision-making, in the strategy, in the work, in the outcome, and in the final score. And let's all cherish and uphold the physician-patient relationship, the healthcare system community relationship that among human interactions remains both unique and profound. Thank you.